Wyong, we're rallying for safer conditions in Wyong's emergency department to get 3 extra staff, 1 to 3 in ED.
Every year, more and more people coming with more and more complex cases. Staffing levels are inadequate and the nurses working in ED are concerned that it's unsafe.
We're working short continuously, pushing ourselves to the limits and just overall exhausted and burnt out.
The nurses leave the hospital after a shift feeling like they haven't done enough or they could have done more, and they dread coming to work for their next shift because they know it's going to be a gruelling 12 hours of being pushed to your limits.
Our patients are being ripped off, really. They're not getting the care that they deserve and that they need.
With the more presentations, the doctors can't keep up with the care as well, so unfortunately that means there's a lot longer wait times.
This hospital is the heart of our community. Our community fundraised to build this hospital. Then the state government tried to sell it off, and now they're not properly supporting you to do your job. And that affects patient care, and it affects you as nurses and midwives in providing that care.
This is a government that's got its priorities all wrong, and for them to say that they can't prioritise hospitals like Wyong to provide those extra staff is simply ridiculous.
Over the last 12 months, we've seen quite a significant increase in the number of patients presenting to Wyong Emergency, and those patients are sicker.
We are getting more elderly people coming in. A lot of them have a lot of comorbidities, unfortunately they do come with them, and we find that that does come with a bigger workload to deal with, to take into consideration when treating them and giving them effective care.
The government came out spruiking about all the money that they were spending at the last election on health services. But that did not equate to boots on the ground. It did not equate to ratios of 1 to 3 in ED.
And you shouldn't be coming into work knowing that the number of staff that you need on the floor may not even be there, because you are the people who care for the coast.
And we are seeing increasing number of staff burnt out, changing jobs just because they can't keep up with the demands of the department. They're leaving. We're losing much needed nurses because they are going elsewhere where it is a better environment to work.
We're losing sight of why we started being nurses in the first place. You've worked your butt off all day long, and by the end of the day you feel like you've got nowhere.
We would like 3 extra staff members per shift to help fill some gaps and help improve the care that we can give to the patients on the coast.
It's important that we keep rallying. We will come back every time you are here.
At the end of the day, you will prevail because you've got right on your side, you've got the community on your side.
So we've got good support behind us. We just really need to push hard and get our voices heard and get the message out there that we're not going to stand down, we're going to keep fighting.